It is important that in the midst of respiratory seasons, a variety of different viruses or bacteria can cause. And if symptoms are severe, so particularly if you have difficulty breathing or you're not improving after a few days to a week, it is important to continue to seek medical attention. But going back to it, there are things that will help. The single most important thing we can do to prevent getting sick in this time of year is to strengthen our immune system by getting the updated COVID vaccines and our influenza vaccine. And most people this year are able to get those at the same time. We know that this process began in October with our priority population, so older people, residents of long-term care homes, Indigenous people, pregnant people, healthcare workers. To date, by the end of yesterday, we had 1.4 million doses of influenza vaccines and more than 1.2 million doses of the COVID vaccines this season. So we know that these are well matched, as I mentioned, to what we're seeing circulate. And for those who have not yet booked your, get that gift now. If you get those vaccines this week, they're widely available across the province in over 800 pharmacies, and you can get those vaccines now. You'll be protected as you go into the main part of the holiday season. You do this for your friends, your family, your teammates, and for our community. We know from what we've seen in the past years that the holidays can be a time where illness spreads when we get together with family, friends, loved ones, and primarily. And we need to keep our guard up and take important steps like getting those vaccines now. As well, we want to make sure that when we do get together, we get together safely. We know there are important messages. Again, the importance of those healthy habits, cleaning our hands regularly, cover your cough or sneeze, wearing a mask if you're going to be in indoor spaces with others and you have mild symptoms or are still recovering, or if you're somebody who is at high risk, you're wearing a well-fitted mask if you need to be in indoor or crowded spaces. But really importantly, this includes staying home if you have symptoms of a cough, a runny nose, fatigue, and especially a fever. A fever is generally an indication that may be transmissible to others. And so if you're the one hosting or part of gatherings this holiday season, make it okay for people who aren't feeling well not to come in person. We have all learned over these last few ways. There's ways to make it easy and meaningful for people to participate remotely and still be part of the gathering, whether it's using virtual visits or postponing a visit to somebody in long-term care until you are well. These are ways to love and protect those who are at most risk of severe illness or complications if they get sick. As I said, there's plenty of supply of vaccine province-wide, and you can get an appointment in your area this week. Like the more than 1 million people who've already done that, we can all do our part, and it is not too late to make a big difference in trying to prevent the spread of influenza over the next few weeks. Especially urge those who are over age of 80 or people who are clinically extremely vulnerable to book your shot today. We know that over half of people over age 65 have gotten both their vaccines, but there's still a risk out there for many. So the other thing I want to note is that last week Health Canada approved the updated Novavax vaccine. So this is a more traditional protein subunit vaccine, also designed to protect against the circulating strain. So it's based on SARS-CoV-2 strain as well. And it will be available starting this week in BC for people who prefer not to have the mRNA vaccines or have had issues with them in the past. And it's available for people 12 years of age and up. So if you still need to book an appointment or wants to find out about the Novavax vaccine, I encourage you to call 1-833-838-2323 for assistance if you need it, or you can go to the Get Registered online. I do want to make a comment about avian influenza. You may be aware that we continue to see an increase in high pathogenic avian influenza activity in British Columbia, and that's affecting more than 50 flocks around primarily the Lower Mainland, but also the on Vancouver Island have been infected with this strain of bird flu or avian influenza called H5N1. There's always a concern that a person could become infected with human influenza and avian at the same time, and that could provide an opportunity for this virus to mutate, to infect humans more easily, and increase the risk of a pandemic. To reduce that potential, getting the seasonal influenza vaccine is especially important for people who are working in the poultry industry, and we've been having a partnership with the Ministry of Agriculture, with CFIA, with the poultry producers here and public health to make sure that people working in the industry have access to vaccine and to the personal protective equipment they need. And why we know that this virus is spreading globally through migratory wildfowl, so things like ducks and geese who migrate, and it mostly affects birds like chickens, turkey, geese, and ducks. It can affect other wild animals, and we've seen that happen as well, including cats and bears and mink. This is a good opportunity to remind everyone that if you do come across sick or dead wild animal or birds, you shouldn't touch them or bring them home with you, and make sure that pets as well keep them away from sick or dead animals. You can report them as well. If you come across a dead bird, you can report it by calling 1-866-431-BIRD, which is 2473. So generally, as we enter this holiday season and celebrations and gatherings, so important for us after all we've been through in the last few years, it's time now, it's not too late, to get your updated COVID-19 and influenza vaccines if you haven't done that already. We all need to continue to do this part for ourselves, for our family, our friends, and for those who are more vulnerable in our communities. So the best things we can do are staying up to date with our vaccinations, taking those regular precautions that should be part of our life now, like covering your mouth with your sleeve or elbow when you cough, wearing a mask when it's needed, cleaning your hands regularly, and of course checking in with yourself and your children and making sure if you are sick with something that can pass on to others, that you stay away until you're feeling better. We can all spend time with the ones we love and ensure we aren't passing on an unwanted guest at the same time. So thank you very much. I hope everybody enjoys a happy and safe and healthy holiday season.